a very, very big thank you to the United Nations Population Fund and the Planning Institute of Jamaica for organizing this breakfast launch ceremony. And I think you deserve to give both teams a round of applause. I must say their wisdom in feeding us this morning will pay some excellent dividends, because I see everybody in the room looking energized and they're ready to work and learn for the rest of these proceedings. The report entitled Power of Choice, Reproductive Rights and the Demographic Transition is as cogent as it is complex, speaking to issues of power, choice, sexual and reproductive health, and speaking to issues as it relates to birth and its impact, marriages, death, age distribution, and other relevant factors to the demographic landscape in which we find ourselves. Despite the depth and complexity of the report, when you read it, the message is quite clear. All countries, including Jamaica, must recognize that our populations change. We must change. Our population must change. Our plans must be flexible, while our governments must be sensitive, forward-thinking, and responsible. We must make sure that all systems and services that work for our people not only support sexual and reproductive health, but also functions to ensure that people are empowered to make the best reproductive health choices at all stages of their lives. In Jamaica, we are seeing rapid changes in our population structure, and this change, along with the expected responses, ring true in the underlying theme of the report that choice changes all. As people are given the choice to control their lives, their health, their productivity, and their reproductivity, all of us, every one of us, are impacted. Choices bring change. More people have become much more familiar with healthy options for living. When combined with modern healthcare and medicine, for us in Jamaica, somewhat free, for others, not so free, it begins to be a stark reality, and it is becoming one that is unabated, of course, that reinvigorating of our health through our new exercise culture. I think I see so many 5Ks in Jamaica, I've never seen them before, instead of the old things we used to do, which was partying for a couple of hours. And I am very proud of my Minister of Health, because these days he parties with Jamaica Moves, and so many of us have been joining in that party. The change brings more people living what? Longer. The result is that we have more senior citizens in our midst than ever before in our history. Secondly, we have more professionalized our population, haven't we? Including more women who are educated and who have exhibited the choice to place profession before procreation. This, along with a reduction in teen pregnancies and the success of the age-old family planning campaign, Two is Better Than Too Many, results in fewer children being born in Jamaican families. When I was growing up, a regular working class family boasted some 6 to 8 children, and it was the norm. My mom had 6 of us. That has now been reduced. In many cases, for me, 2. For many more, none. Isn't that so? Yes. Partners have sought to advance their careers They've sought to delay childbearing for financial stability or education or career advancement. This choice of a different approach is therefore resulting in a change in fertility rates, which are falling and falling and falling. These two scenarios, displaying the effect of choice, are clear in their effect at every level. For our population to eventually sustain themselves, we will need to ensure that we have a reduction in maternal deaths, in infant mortality, and in children born with disabilities due to infections, whether sexually transmitted or not. We must ensure that though few of us are being born, they are given a greater chance to lead healthier lives and become far more productive citizens.